Hi everybody, my name is Jason Bellissimo. The topic of today's discussion is management of the obese patient with OA and what creates a better surgical candidate. With me today I've got Ted Burris. Ted, thanks for your time, I really appreciate it.
Very welcome, happy to do it.
As I described with that topic, I wanted to take a couple minutes and interview you. Ted Burris has been a longtime customer of OSER. He's very well versed in all of our products. Specifically the Unloader 1 and the Unloader 80J. Ted, when did you get your start and what prompted you using our braces?
In '88, I went into this business based upon seeing an ad that Generation 2 of Bothell, the original American subsidiary of Generation 2 in the USA, and an unloader brace was amazing. I previously, prior to that, had spent 8 years as a surgical tech and assistant here locally, and have scrubbed on many knee replacements and many failed knee replacements and revision knee replacements. So constantly seeing patients that were too young, too obese, implants that failed, and revisions of those, and how can we maybe create a better surgical candidate versus maybe getting into things when they're too young and active.
With the obese patients and the cases that you sat in on, and the providers that you worked with in the past, as well as your role in today's market with the providers that you service, what have you seen to be an advantage for a patient that is obese, that has an opportunity to incorporate bracing?
Yeah, many of the doctors have been reluctant to refer an obese patient our way because they were concerned that the brace would be overloaded by weight and that it would not work and that it would be harder for patients to put on. Certainly their argument is valid with models that first came out, and we started working with the models that we had. The Select 80J was the brace that we chose to start to make some changes to for the morbidly or obese patient. And again, they are terrible surgical candidates, and they weren't even offered braces because physicians didn't think that braces would work, but we've proven that right.
Through CMS and Medicare, as pertains to bracing, and using bracing as a conservative treatment, have you found that to be useful?
Yes. Insurance companies are going to be supportive of anything that is in the best interest of the patient out there.
Okay. Now again, I know you've done a ton of these braces. 1988, you say you do your first one or something like that. How many of these braces have you done since you've got your start, do you think?
Well, we estimate somewhere around 13,000.
13,000. So the guy knows the product mix. In the next minute or so, would you give us some tips and tricks as to why you find this to be a very beneficial brace for your larger patients?
Well, I recommend this brace in particular now for increased deformities and also increased size. And it's basic physics. For every action you get an equal and opposite reaction. So you can see if we're putting an action across the brace in this direction created by the dynamic force strap to the hinge, the adjustment we have in the hinge receives that action and exerts a reaction by unloading the knee. I have
All the brace.
I have a photocopy here of an X-ray, and you can see here's our patient with unicompartmental osteoarthritis, and here there's the same patient, Select 80J on. You can see there's quite a bit of adjustment up here. I usually adjust with the patient's legs straight out, looking for a gap of at least a finger. If they're a little larger, maybe a nice fat thumb worth. But but that's about it to start with. And this is the effect we get. And we also get that same effect. Here's a lateral and a lateral braced. Little less, probably a skinny finger's worth of gap between the inner thigh and the inner shell, and that does well. When we apply the brace, we always make sure that when the patient is standing, that they adjust their dynamic force strap so there is a slight pressure there. A very useful part of the fitting is to have them walk in the brace. I always ask them the question, if your knee pain was a 10 when you walked in, what is it now? Routinely we hear back it's about a 5, about 50% less. And we explain to them, this is something we're going to talk about here in a minute, you know, what's happening in their knee. But the other very good demonstration to do for a patient is to have them walk up and down in front of you, totally loosen this up and show them the difference. And they'll report back, gosh, that feels like my knee feels all the time. Bring this up tight again and their knee pain goes away. At that point, that patient will not let this brace go.
Nice. Well, I appreciate all that information. I appreciate your continued support within the Northwest region. You've been a huge resource to myself in regards to educating me on this product family, as well as I know the Unloader 1, but getting to know the style hinge, shells, the single DFS strap, and stuff of that sort. I look forward to working with you, and appreciate your time.